big issue that we are looking at closely after the Supreme Court has pulled up the state governments, asking them a status report of their preparedness for the COVID crisis. The important points that has come out here, as per the latest figures, 75% of deaths over the past 24 hours are concentrated in 10 states and union territories. Delhi remains a major concern, contributing to 24% of the fatalities in that time period. Amid laxity of adhering to norms, certain states like Maharashtra and Haryana are now considering lockdowns. Meanwhile, night curfew has been clamped in parts of Gujarat and Rajasthan. In fact, to discuss this entire issue and also to help us understand which are the primary concerns that a country needs to deal with immediately on war footing, I am now joined by Dr. Anand Bhan, researcher from Global Health, and also Dr. Tanmay Mahapatra, epidemiologist, UCLA. Welcome, gentlemen, for joining. Thanks so much for joining us here on Mirror Now this afternoon. I would like to begin by asking you, Dr. Bhan, that the primary issue, or rather the primary dilemma before a lot of state governments at this point is whether to go back to another imposition of lockdown or whether to ensure that there is a stricter enforcement of the COVID norms. And like we have been saying, there's a huge laxity witnessed both on the part of the citizens in observing COVID discipline and on the part of the authorities in ensuring and implementing COVID protocols.
Sure. Thanks, Afrida, for having me. Yes, it's going to be a difficult decision to take from a policy perspective. We have to recognize that some of us had already warned of this potential outcome, given that there was laxity, there was a lack of adherence to prevention norms such as physical distancing, wearing of masks, etc., and that there was a festive season coming. So now we are seeing a repercussion of the fact that we had a lot of social interactions during the Dashera, the Diwali period. And on top of that, you have to layer on winter in North India. You have to layer on the pollution, which happens usually at this time, which can also mean more respiratory ailments. And that by itself should scare us. The reason we should be scared is that with the rising number of cases, especially those which require hospitalization, our health system could get further stressed out. There are already shortage of health workers. As you know, many states have tried to recruit health workers, including medical students, because there aren't enough health workers to work with. And if the number of cases increases, you can imagine what that would mean. Also, because the non-COVID care also will require to be focused on. We know that that has suffered for a while. So imagine the fact that you have increasing COVID cases, you have many patients of non-COVID conditions who require care. So will that mean that we should go in for a lockdown? Because that was your question. I don't think lockdowns are in any way a perfect panacea or an answer. Lockdowns are useful, but then lockdowns have to be used strategically, and they have to be used strategically for things that we should have done by now, which is increase our facility strength, increase our human resources, and increase our testing in a way that we were able to pick up cases quickly enough, isolate them, trace contacts. If you're not doing that right, you can have another lockdown and we will continue to have these problems. So I don't think lockdown is an answer. Yes, we need to work with communities. We need to work with the public to increase adherence. We need to show role modeling by our political leaders, which, in many cases, as your channel has also shown, they've often themselves not used masks, etc. So we cannot expect our public to do it when our leaders are not. So I think it's extremely important for us to campaign and work with communities in enhanced adherence, but we also have to be very cognizant of the risks involved right now.
Right, absolutely. And, so therefore, a lot depends on how the government of the day strategizes. Like you said, lockdowns have to be used consciously, strategically, and at the right time for it to have a certain amount of benefit in terms of restricting the spread of the virus. Dr. Tanmay Mahapatra, the issue at hand, of course, like we've been discussing, is about whether, since the government is not able to handle, given our sheer number of people and population, markets are getting crowded, maintaining COVID discipline, especially social distancing, is a major challenge. But, while we talk about social distancing, hand hygiene, mask protection, not enough is being spoken about the high-risk situations. Perhaps there should be more focus on certain areas, like, for example, enclosed spaces, or those arguments are not being brought out effectively effectively about enclosed versus open spaces, for instance, or say which are the surfaces we have to be more wary of, whether metal and plastic is to be more, infectious than say wooden surfaces. At a personal level, when we are dealing with this, for the individual, what would you have to say, Dr. Mahapatra?
So there are five things that I want to highlight in this scenario. Number one, we are talking about what may be the more risky scenario, or maybe the scenario regarding the closed spaces and what surfaces. But first of all, the basic things regarding the personal protections, the mask, the social distancing, and being ensuring that we are having the personal hygiene and all those stuff maintained. I don't think that that has been actually gone into a community level of understanding and awareness for continued requirement of this. The general perception, and given the fact that everybody was looking at media and all other stuffs to see what is happening regarding the curve, whether we are having the end of it, etc., over these 9-10 months. The problematic aspect is nothing has gone beyond a certain level of momentary changes. We are actually going through a kind of a scenario when we don't know whether things have already changed from the first wave. That is, first wave is over or not, we really don't know. That is the first point. Number two, second is when we are actually expecting a second wave, which can be in a different geography, which can be more fatal also. But all these things that you were mentioning regarding closed spaces, we have to ensure that we are having as much aeration and all stuff possible. Try to avoid having meeting people and all those stuff if not required. And then came this festive situation. All these festivities actually ultimately ended up, if we look at everywhere, we will find that people were actually meeting each other after a long period of secluded environment, as if everything is coming to a halt. It was required to ensure that people understand that city have been only within mind and only dealt with being in the self-isolation and quarantine for people who are having disease or having some symptoms, whereas for others the required precautions were required to be completely critical. Now, regarding surfaces and all those stuff, I don't think there is a very clear idea about all this. Definitely, we need to take care of areas where things are wet or a live substance can thrive on those. But the initial basic things need to continue with equal rigor and vigor to ensure people understand how to take care of themselves.
Yes, that's an important point you made, that we don't yet know whether the first wave is over, and therefore for any kind of prediction on when the second wave will hit, at this moment it's not clear. But then, having said that, coming to you, Dr. Pan, while we are of course all looking at this issue of whether we should be prepared for a second wave and how much worse will it be, that is the primary question. But if we look at specific issues, for instance, is the issue of opening markets. It's being looked at from the perspective of economic considerations. There are pressures from the traders, and the governments often tend to succumb to some of those pressures as well. And therefore, like for instance in Delhi, there was one decision taken to close markets in Nangloi. That decision was reversed for whatever reason. So there are these compulsions. Do you think that it's becoming difficult for a country like ours to navigate around these complex issues?
It is certainly difficult, and it's understandable to some extent. But what you also need at this time is nimble policy making, which is evidence based. You cannot have decisions being taken on the huff without a clear understanding of what the thinking behind those decisions is. A good example is the night curfews. What exactly do they accomplish besides just showing that you are doing something? I mean, it's not like there is a whole lot of people going out and meeting each other in the night, right? It's not like, what the actual risk is in those platforms that you talked about: markets, indoor spaces, travel platforms, etc., which is where we need extra caution and ensuring that due care is taken. But actually, a lot of the decision making is focused on the optics of a response rather than actually substantive responses. So actually, that is part of the problem, that we're not seeing enough public health thoughts into the decision making. It's often a law and order response, which is easy to do. You can come out with a geo or you can come out with a notification, but that's often not enough. You need to think through properly and involve public health experts. And then, sometimes you will have to withdraw a decision because it's not working and then come up with a new decision. But hopefully that is also done in a transparent way and with evidence in mind. So that is extremely important from my perspective. This whole thing about waves, I think, is important, but we also have to recognize that, we have a bunch of waves already in this country, because we know that we have a large, diverse country where, earlier it was a largely urban pandemic. Now it's also an urban and rural pandemic. And at various parts in the country, the spread of infection is happening at a different rate. So it's not going to be that the case that there will be just this discrete one national wave and then another wave. There's going to be a range of waves across the country. And that's why we also need local handling of this pandemic to be effective.
Okay. Yes, absolutely. Local handling of the pandemic, that's the moot point. And like you said, it's not like we're going to have one major wave across the country. There would be several local waves. These are important things that the states, in fact, will have to look at. And therefore, we are also looking at how much of the responsibility will the center have to take on this, and what is the larger responsibility that the states, given the local nature of things, that they will have to do, which is why the Supreme Court in fact has pulled up the state governments, and the Prime Minister is going to have a review meeting with the heads of the states tomorrow. My colleague Tanima is with us to give us an understanding right now of certain issues, like, for instance, let's look at states which are now considering the return of the lockdown. Tanima, over to you for certain states which have now taken note of the situation, of their peculiar conditions, and also announced certain measures. Over to you.
That's right, Afrida. If we look at the entire stock of states which have seen a spike over the past 1 week or 2 weeks or so post-Diwali period, actually, there are two categories of states that we look at. Some who have already been proactive about it and taken certain measures which are in a way lockdown related. So you can see that Gujarat has actually imposed night curfew in 4 of its key cities, including Ahmedabad. And also, if you look at Rajasthan, which has also seen a major spike recently, breaching 3,000 daily cases for the first time ever since the pandemic hit the state, there are 8 districts in which night curfew has in fact been imposed. So this is one category of states which has seen recent spike post the festival season, and this is what they have done in terms of bringing back certain lockdown measures that we had seen earlier. The other category of states, if we look at, that is basically the category of states who have seen a spike but are still mulling on whether or not to bring back a lockdown. Maharashtra, of course, one of the states which has always been in the news for the past several months, that has said they will decide take a decision in 8 to 10 days. Haryana essentially saying, the health minister today saying they can reimpose lockdown because there are only 2 options in front of the state government, either to increase their vigil, to increase the restrictions in terms of actually enforcing the norms, or to have a total lockdown back in the state once again.
Right. Tanima, also, since we are discussing how bulk of these 10 states are actually contributing the maximum to the fatalities, the worst affected 10 states, can you take us through some data that we have on this, on which are the states that are actually contributing very high numbers to the country's fatality rate?
Right, exactly. In fact, as you were saying, that there are 10 states which are specifically being looked at by the center. The center has in fact rushed teams to some of these states already. If we look at some of these states a little more closely, of course, the national capital, where there are over 5 lakh confirmed cases. The active case figure is of course much less, but nonetheless, this is of course something which is concerning. And over the past 1 week or so, we have seen around over 40,000 cases which have been added to this total caseload, and which is the reason why it's a concern. The doubling period is around 55 days in Delhi. If we look at the recovery rate also in Delhi is at 98%, fatality rate not too high, close to the national average, but still a concern. Positivity rate is probably one of the highest that we have seen across different states in the country. If you look at other important states, Gujarat, where the total confirmed cases may not be as high, but the active cases have in fact gone up. This is a figure that we look at, wasn't like this till about a week ago, but now Gujarat is seeing a high number of active cases. In fact, the center also said that some of these states may not be seeing a huge daily spike, but active cases have in fact gone up. Deaths around 3,800 odd, doubling period still much better than what we have seen in states like Delhi and Maharashtra at 111. Its recovery rate still at 98%. The fatality rate is actually higher than Delhi at the moment. So that is also a cause of concern for Gujarat. If we look at the following states, Maharashtra confirmed cases really high, 17.74 lakhs, the total caseload. Active cases, of course, standing close to a lakh, around 80,878. Deaths at 46,573. The doubling rate, not so bad at 307. It was much worse earlier. But of course, there's been a recent spike that we have seen in the state post the festive season. 97% recovery rate, fatality rate at 2.8%. And if we see Punjab, where again, not one of the worst of states, but has in fact seen a spike in recent cases. Out of this 6,561, if I can tell you, Afrida, 3,000 of these have actually been added sort of in past 1 week alone. So that is why it is a cause of concern. If you look at the following data as well, following page for Punjab, the fatality rate also standing at 3.3% and positivity rate not so bad at 3.9%. And Rajasthan, the last state, 2.4 lakh total confirmed cases. Active cases have in fact gone up recently, 21,951, and the doubling rate is at 71. So that is also not a very good number that Rajasthan would like to have. It was much better earlier. Fatality rate is not too high, 1%, but the positivity rate is 12%, almost as much as Delhi actually. So these are some of the states which are a major concern, which have seen a lot of a spike in COVID cases recently. And if the socks are not pulled up, as we can metaphorically say right now by these states, then possibly the Supreme Court is saying that it could be much worse in December.
Yes, which is why we are having this discussion today. And I will just take closing comments from Dr. Bhan and Dr. Mahapatra on the issue of public health policy. Dr. Bhan, if you can give us your thoughts on the issue of, say, reopening of schools, on the issue of traveling, socializing, because people, citizens want to know about these things. Different states have taken a different decision with regards to opening of schools. How prudent it is to have schools and colleges open at a time like this, and what juncture exactly do you think we are in right now in the overall COVID curve?
Yeah, so I mean, as the numbers highlight, it's certainly a cause for concern across states. It's also the case that the active cases that we are seeing are a very small subset of the actual number of cases. Seroprevalence studies have already shown that the actual number of infections is fairly high, and this is government data. So I don't think this is the time to open up schools. I think any non-essential, very non-essential activity should be curtailed. People have to really recognize the risk to themselves, their families, and their communities, and the government has to play the role of governance and regulation. So anything which doesn't need to be really done should not be done, and I think we should all try our best to try to reduce the caseload by minimizing any risk attached to any of our activities. And if we do that collectively, hopefully we'll be able to bring down the caseload. If we don't, then in the absence of a vaccine, and if we don't follow public health measures, again, we are going to likely see more number of cases happening.
Right. Dr. Mahapatra, your quick comment on that, because some governments like the Maharashtra government is actually considering halting traveling from the hotspot cities like Delhi because of the fear of a second wave hitting Mumbai. How prudent would you say is that?
Some kind of restriction on the travel will be required, because we are not only talking about traveling, we are talking about traveling in a situation when rush and crowd during the rush hours will be tough to control under the public health measures that Dr. Bhan was talking about. So some kind of restriction, the kind of picture that you are showing right now, in this kind of situation, there is controlling the first wave and preventing the second wave is just impossible. So public health measures, making the community aware of their own safety, as well as thinking about the whole situation in a pragmatic way, that how we can live few more months, if not years, with necessity only, and avoiding all kind of things which can be delayed for a few months or days, are the requirement, and government needs to make those things clear and loud for the population to take informed decisions.
All right. Thanks very much, gentlemen, for joining us, Dr. Tanmay Mahapatra and Dr. Anand Pan, for giving us your time. Well, that's all we could pack in for you at this hour. News and updates continue here on Mirror Now. Do stay with us. And also, do visit us on our website, mirrornownews.com. Follow us on Facebook, Twitter, Instagram, and Telegram. Thanks for watching.